An advisory panel could bring booster shots to all Americans next week, but here in New York State, the governor has ramped up the urgency.
That's right. This week, Governor Hochul said she wants all adults in high transmission areas to get a booster. Monroe County is considered a high transmission area, and the numbers are still climbing. Today, 451 new cases reported. 320 people are in the hospital. That's 18 more people since yesterday. 91 of those patients are in the ICU this evening. Jack Watson spoke with health leaders about how the booster shot could help to reverse this trend. Jack.
Adam, we are undoubtedly in a high transmission zone in the Finger Lakes region, actually second in New York State, just behind Western New York, which includes Erie and Niagara counties. I spoke with a few local doctors about their thoughts on the governor's announcement yesterday. Here's what they had to say. A booster shot will mean different things to different people, so says Dr. Angela Branch with the University of Rochester Medical Center.
For some people, the boosters won't necessarily add to that protection you already have in terms of severe illness, but it might prevent you from getting infected at all and therefore decrease risk of transmission to other people.
According to Dr. Branch, your priority to get a booster depends on your risk and circumstances. For all adults who live in a high transmission area like ours, this week the governor gave a stamp of approval in no unclear terms.
I want to be clear about that. You live in a high transmission area, there is risk. If you personally feel that risk, and it'd be hard to imagine anybody who doesn't, because you're among people, you're at work, sometimes in public transportation, you should be getting a booster shot now.
Even before the holidays start and families travel and meet indoors, COVID cases and hospitalizations are jumping. A positivity rate pushing 9% in the Finger Lakes region. Almost 1 in every 10 tests are coming back positive.
The intended effect is that it will reduce the transmission rate, especially for those who are far out from their original series, from their primary series.
According to Dr. Emil Lesho, if you get the booster and lots more get it, it could help bring down the huge COVID numbers. You bring down infections, you bring down the likelihood of another variant of concern. Well, Thanksgiving is, of course, just around the corner. A lot of us are going to be visiting family members who may be at high risk. And again, doctors emphasize that the stress that you put on getting a booster should come from your personal risk and the risk of your family. We are live in Rochester. Jack Watson, News 8.